Here's something you may have experienced, but you just didn't know it. Post-COVID-19 syndrome. It's when you have symptoms after you've recovered from the virus.
That's right, Laura. And doctors at Mayo Clinic are studying this because they say it can affect our society and the economy. ABC 6 News reporter Devin Martin spoke to the lead author of the research.
Post-COVID syndrome is not just a problem for healthcare, but a problem for our economy and our society.
Mayo Clinic released a study about post-COVID-19 syndrome, and what they learned, they were even surprised about. 45% of patients studied, mostly women, had troubles with thinking like short-term memory loss, multitasking, and speech.
What we have found is that of all the symptoms that patients can have with post-COVID syndrome, it's often this trouble of thinking, or what people normally call brain fog, that is the most distressing because it interferes with their ability to work.
And that's when Dr. Vanichkachorn and his team wanted to look into how post-COVID-19 syndrome impacts a person's daily functions. And here are the numbers. Out of 100 people who participated in the COVID-19 activity rehabilitation program, Dr. Vanichkachorn says 80% reported unusual fatigue, 59% had respiratory complaints, and more than one-third of patients reported difficulty performing daily basic activities, like brushing their teeth and cleaning their home. 60% of patients were not able to get back to their jobs even months after their COVID-19 infection.
I'm hopeful that society as well as employers will become more aware about these functional limitations and help their employees.
Dr. Vanichkachorn says if you are diagnosed with this, to get help.
If you are suffering symptoms that you think are related to prolonged COVID, don't be afraid to reach out for help and self-advocate for yourself.
Researching for change and some answers.
We're going to have a lot better understanding of what is going on inside the body.
In Rochester, Devin Martin, ABC 6 News.